Hi, I just wanted to follow up on our second podcast that we had last week, where we discussed how we can wrap our heads around the autism diagnosis. And we addressed some of the pitfalls of conventional medicine. I thought it was too important not to address this with a quick follow-up video. So our children have pediatricians that we trust and that are supposed to have the best interest of our kids in mind. When it comes to autism, however, I think many of us feel left in the dark, with little to no interest of the pediatrician to possibly investigate if there are laboratory evidences of deficiencies and or toxicities. But why is it that they have no interest? As physicians, we have education in college and in medical school, and we have schooling, usually in residency. The problem is the schooling, in my opinion, as it doesn't allow for critical thinking, but it rather blindly follows preset management recommendations by the alleged leading authorities on that subject. Since there's little time for critical thinking, mostly due to full schedules and time constraints, the recommendations set out by these societies are hence pretty damn convenient. So let's look at this again. One in 6 children in this country have a developmental or learning disability. That's about 17% of all of our children. With 4 million births in the United States every year, a conservative estimate is that about 90,000 new patients are diagnosed with autism every year. Although in up to 10% of autism cases, there is a reasonably well-defined reason, for example, genetic reasons, most cases are idiopathic, unknown. So when we go in regards to recommendations of management, when we go to the CDC, Center for Disease Control, the types of treatments that are recommended or offered are behavioral, developmental, educational, social, relational, pharmacological, psychological, as well as complementary and alternative. So how do they define this? So complementary and alternative treatments, according to the CDC, are often used to supplement more traditional approaches. They might include special diets, herbal supplements, chiropractic care, animal therapy, arts therapy, mindfulness, or relaxation therapies. Individuals and families, however, should always talk to their doctor, in this case, the pediatrician, before starting a complementary and alternative treatment. So as physician, I have a resource called UpToDate, which many physicians use. In fact, hospitals subscribe to this service because it's a very quick reference guide in regards to the latest and greatest that conventional medicine has to offer. UpToDate is an evidence-based, physician-authored clinical decision support resource that assists clinicians with point-of-care decisions. More than 1.9 million clinicians in 190 countries rely on UpToDate to make the best care decisions and stay abreast of contemporary standards in their workflow and on the go. So let's see what UpToDate is telling us in regards to autism. The goals are obviously to maximize functioning, move the child towards independence, and improve the quality of life. Specific goals address the core deficits of ASD and seek to improve social functioning and play skills, improve communication skills, improve adaptive skills, decrease non-functional and negative behaviors, promote academic functioning and cognition. So who makes that happen for us? This team of providers, developmental pediatricians, child neurologists, child psychiatrists, psychologists, neuropsychologists, geneticists, speech pathologists, occupational therapists, audiologists, and social workers. Interestingly, UpToDate mentions that there are tests that are not indicated in autism. For example, tests for yeast metabolites, gut permeability, heavy metals, other than that, trace elements, micronutrients, and immune abnormalities are not indicated since there are no empiric data to support such analyses. And so when we look at this in fine print, which many pediatricians, I would say, are not further looking into this. What are they basing their recommendations on? So we see this number 4 here, which is usually linked to a reference. And when you look up that reference, it's a paper that was written in 2000 entitled Practice Parameter, Screening and Diagnosis of Autism, Report of the Quality Standards Subcommittee of the American Academy of Neurology and the Child Neurology Society. Whoa. So in that paper, in regards to metabolic testing, it says that inborn errors in amino acid, carbohydrate, purine, peptine, and mitochondrial metabolism, as well as toxicology studies have been studied, but the percentage of children with autism who have a metabolic disorder is probably less. And some experts agree that it is considerably less than 5%. Well, let's look at those references. This paper quoted 2 papers that were published in 1997. I'll say, well, that's funny. What's this foolishness? I think it's worse than failure, because we have 2023, and that is about 25 years after that they make these recommendations. This is completely outdated. And so your pediatrician reads this, and we can cross this off. Complementary and alternative medicine is quackery. 25 years later, however, we have new technologies. We have PCR technology, we have genetic testing, we have advanced lab reports. We have gained a lot of knowledge. There's a lot out there. In regards to testing, we have genetic SNPs, parasite testing, microbiome, mold testing, neurotransmitters, metabolic analysis, mold toxin testing, iron studies, ammonia, advanced immune testing. We have, in regards to treatments, in the alternative realms, 16S microbiome balancing, we have neurofeedback, spelling to communicate, viral therapy, yeast mold therapy, primitive reflex training, stool transplants, herbal medicine, homeopathy, chelation, HBOT Lyme. Now, I don't necessarily do all of these or agree with all of these, but nevertheless, parents have over the years had great success with many of these. And this is available to us about quarter century after the recommendations that were set out by our societies. And so I think it is important to look at that, to keep this in mind, to hopefully engage in a discussion with your pediatrician that we could potentially look into this further. I think it needs to be done. It's a shame. Unfortunately, if your pediatrician does not want to work with you, I would say find a physician that will. With that being said, looking forward to more insights and more discussions that we will have in our podcast, and hopefully more of these little videos. Thank you. Bye.